Did you know that right now, as you're watching this video, there's a silent thief stealing your independence? And here's what's truly alarming. 1 in 4 people over 55 will experience this thief attacking them this year. I'm talking about knee pain. And if you've been told it's just normal aging or something you have to live with, I need you to stop what you're doing and listen very carefully, because what I'm about to share could change everything. I've seen far too many people lose their ability to garden, play with their grandchildren, or even walk to the mailbox, simply because they believed knee pain was inevitable. But here's the truth that most doctors won't take the time to explain. Knee pain is not a normal part of aging, and you do not have to accept it. By the end of this video, you'll understand exactly what's happening inside your knee, why it's happening, and most importantly, the specific, scientifically proven steps you can take starting today to reclaim your mobility and your freedom. Because let me be clear, every day you wait, every day you ignore that stiffness or that grinding sensation, your joints are deteriorating further. But the good news? We can stop it. We can even reverse some of the damage. So if you've been struggling with knee pain, if you've been afraid you might need surgery, or if you're worried about becoming dependent on others, this video is for you. Stay with me. First, let's talk about what's really happening inside your knee, because understanding this is the key to fixing it. Your knee is one of the most complex joints in your entire body. Every single step you take, your knees absorb about 1.5 times your body weight. Think about that. If you weigh 150 pounds, your knees are handling 225 pounds with every step. Over a lifetime, that's millions of impacts. Now, inside your knee, you have something called cartilage. It's like a cushion between your bones. When you're younger, this cartilage is thick, smooth, and it allows your bones to glide past each other effortlessly. But here's what happens as we age. This cartilage starts to wear down, and when it wears away completely, your bones begin rubbing directly against each other. This causes 3 things: inflammation, stiffness, and pain. The medical term for this is osteoarthritis, and it's the #1 cause of knee pain in people over 60. In fact, among adults over 70 years old, up to 40% are living with symptomatic knee osteoarthritis right now. But here's what your doctor might not be telling you. Osteoarthritis doesn't just cause pain, it creates a vicious cycle. The pain makes you move less. Moving less makes your joints stiffer. Stiffer joints make movement more painful, and suddenly you're trapped in a downward spiral where every week, every month, you're losing more mobility, more independence, more of the life you love. I've seen patients who stopped taking walks with their spouse, who gave up dancing, who couldn't kneel down to garden anymore, and the emotional toll? It's devastating. Many seniors become isolated, depressed, and lose their sense of purpose, all because of untreated knee pain. But it doesn't have to be this way. Now, let me share the early warning signs that too many people ignore, and why ignoring them is so dangerous. If you're experiencing any of these symptoms, your body is sending you an urgent message. Stiffness when you first wake up or after sitting for more than 30 minutes. A grinding, crunching, or popping sound when you bend or straighten your knee. Pain that gets worse throughout the day, especially after being active. Swelling or warmth around your knee joint. Difficulty fully straightening your knee. Weakness or instability, feeling like your knee might give out when walking or standing. Changes in how you walk. Maybe you've started limping or shifting your weight to compensate. Now here's the critical part. These symptoms don't just appear overnight. They develop gradually, and your brain actually adjusts to the pain over time. You start unconsciously avoiding certain movements. You tell yourself, "It's not that bad," or "I'll deal with it later." But here's the harsh truth. Every day you wait, the cartilage in your knee continues to deteriorate. And once it's gone, it's gone. You cannot grow new cartilage. That's why early intervention is everything. The earlier you act, the more we can preserve, protect, and even improve your knee function. But if you wait until the pain is unbearable, until you can barely walk, your options become much more limited. And often, surgery becomes the only solution. So why is this happening to you? Let's talk about the root causes, because once you understand them, you can start addressing them. There are several key factors that increase your risk. 1. Age and wear and tear. After decades of use, cartilage naturally begins to break down. Think of it like tire treads on a car. After 40,000 to 50,000 miles, they wear out. Your knees are the same. 2. Excess weight. This is huge. Every extra pound you carry puts approximately 4 additional pounds of pressure on your knees. So if you're 20 pounds overweight, that's 80 extra pounds of force on your knee joints with every step. 3. Previous injuries. That old sports injury from high school? That fall you had 10 years ago? Even injuries that seemed completely healed can come back to haunt you as you age. Damaged tissue is more susceptible to arthritis. 4. Inflammation. If you're eating a lot of processed foods, sugary drinks, red meat, and inflammatory foods, you're literally feeding your joint pain. Inflammation in your body directly affects your joints. 5. Lack of muscle strength. Weak muscles around your knee, especially your quadriceps and hamstrings, mean your joints aren't properly supported. This accelerates wear and tear. All right, now for the good news, the part you've been waiting for. Here's exactly what you can do to protect your knees, reduce pain, and restore your mobility. I'm going to give you a comprehensive, science-backed action plan. These aren't just theories. These are strategies I've used successfully with hundreds of patients. Strategy number 1. Anti-inflammatory nutrition. First, we need to stop feeding the inflammation. Starting today, I want you to focus on what I call the joint protection diet. Foods to add: fatty fish, salmon, mackerel, sardines, at least twice a week for omega-3 fatty acids. Leafy greens, spinach, kale, collards, rich in antioxidants. Colorful vegetables, bell peppers, tomatoes, carrots. Berries, blueberries, strawberries, powerful anti-inflammatory compounds. Olive oil, use it daily for cooking and salads. Nuts, walnuts, almonds, but watch portions. Turmeric and ginger, add these spices to your meals. Green tea, drink 2 to 3 cups daily. Foods to minimize: processed foods and fast food, sugary drinks and energy drinks, red meat and processed meats, white bread and refined carbohydrates, excessive alcohol. One study found that seniors who switched to a Mediterranean-style diet experienced significant reductions in joint pain within just 12 weeks. Strategy number 2, targeted supplementation. Now, while diet is fundamental, certain supplements can provide additional support. Here's what the research shows. Key supplements: glucosamine and chondroitin. These are the building blocks of cartilage. Research shows they're nearly as effective as NSAIDs like ibuprofen for reducing moderate to severe knee pain, but without the side effects. Omega-3 fish oil, powerful anti-inflammatory effects. Take 1,000 to 2,000 milligrams daily. Turmeric, curcumin, nature's anti-inflammatory. But here's the key: take it with black pepper, piperine, to increase absorption by 2,000%. Collagen peptides. Studies show that seniors who take collagen supplements while exercising experience better improvements in joint pain and function. Vitamin D, essential for bone health. Many seniors are deficient, and this deficiency is linked to increased knee pain. But listen carefully. Talk to your doctor before starting any new supplement regimen. Supplements can interact with medications, and you want to make sure they're right for your specific situation. Strategy number 3. Smart movement and exercise. Here's the paradox that confuses many people. Your knees hurt, so you stop moving. But not moving actually makes the problem worse. Movement is medicine for your joints. Exercise does 3 critical things. It strengthens the muscles that support your knees. It promotes the production of synovial fluid. That's your joint's natural lubricant. It maintains your range of motion. But, and this is crucial, you need the right kinds of exercise. Best exercises for knee health. Low-impact cardio. Walking, 10 minutes daily, gradually increase. Swimming or water aerobics. Excellent because water supports 90% of your body weight. Cycling or stationary bike. Great for building knee strength without impact. Elliptical machine. Low impact but effective. Strength training. I cannot overemphasize this enough. Strong muscles protect your joints. Leg raises, wall sits, gentle squats, only if comfortable. Resistance band exercises, flexibility work, gentle yoga, Tai Chi, specifically studied for arthritis, daily stretching routine. What to avoid? Running or jogging if you already have knee pain. High-impact aerobics, deep squats with heavy weights. Lunges unless supervised by a physical therapist. Start slowly. Even 10 minutes a day makes a difference. Consistency beats intensity every single time. Strategy number 4, weight management. I know weight loss is a sensitive topic, but we need to address it because the science is clear. Losing even just 10 to 15 pounds can reduce knee pain by up to 50%. Remember what I said earlier. Every pound of body weight creates 4 pounds of pressure on your knees. So losing 10 pounds relieves your knees of 40 pounds of pressure with every step. Focus on portion control, reducing processed foods, increasing vegetables and lean proteins, staying hydrated, at least 8 glasses of water daily, getting adequate sleep. Poor sleep disrupts metabolism. Strategy number 5, protect and support. Daily protection strategies. Proper footwear. Wear supportive shoes with good cushioning. Consider gel inserts if you stand a lot. Posture and ergonomics. Good posture reduces unnecessary stress on joints. Use proper body mechanics when lifting. Heat and cold therapy. Ice for acute pain or swelling, 15 to 20 minutes. Heat for stiffness before activity. Assistive devices. There's no shame in using a cane or walker if needed. These tools reduce knee stress by 25%. Strategy number 6. Know when to seek medical help. See a doctor if you experience severe pain that doesn't improve with rest. Knee gives out or feels unstable. Visible deformity. Fever along with swelling could indicate infection. Pain that persists more than 2 weeks despite self-care. Significant swelling or redness. Your doctor may recommend physical therapy, highly effective. Prescription anti-inflammatories, corticosteroid injections for severe pain. Hyaluronic acid injections for joint lubrication. In severe cases, surgical options like knee replacement. But here's the good news. Only about 2% of people with knee pain actually need surgery. The vast majority can manage their symptoms effectively with the strategies I've just shared. Let me leave you with this. Knee pain is not a life sentence. It's not something you just have to accept because you're getting older. Yes, our bodies change as we age, but we have so much power to influence how we age. Every single day, I see patients who've been told they need surgery, who've been living with pain for years, who thought their active days were behind them. And then they implement these strategies, and their lives transform. Mrs. Johnson, 68 years old, came to me barely able to walk her dog around the block. 6 months later, after following this exact protocol, she hiked 2 miles and told me she felt 20 years younger. Mr. Peterson, 72, was told he needed knee replacement. He lost 20 pounds, started swimming 3 times a week, changed his diet, and added the right supplements. 2 years later, his knee pain is 80% better, and he's canceled his surgery. These stories aren't miracles. They're what happens when you give your body what it needs and stop doing the things that hurt it. So here's my challenge to you. Pick just one strategy from this video. Maybe it's adding salmon to your diet twice a week. Maybe it's starting a 10-minute daily walk. Maybe it's trying turmeric supplements. Just one. Start there, and once that becomes a habit, add another strategy, then another. Small, consistent changes create remarkable results. Your knees have carried you through decades of life. They've taken you places, helped you create memories, allowed you to live independently. They deserve your care and attention. You deserve to walk without pain, to play with your grandchildren, to travel, to garden, to dance, to live fully. And I'm here to help you do exactly that. If you found this video helpful, please give it a thumbs up and subscribe to Dr. Carter's Senior Health Guide for more science-backed health information designed specifically for seniors. Drop a comment below telling me, what's the one strategy you're going to implement this week? I read every single comment, and I'd love to hear from you. Next week, I'll be sharing a video on the 5-minute morning routine to prevent falls. Because maintaining balance becomes even more important when you're managing knee issues. Until then, take care of those knees, take care of yourself, and remember, aging is inevitable, but suffering is optional. I'm Dr. Min-Jun Carter, and I'll see you in the next video.